Alright, so I've been doing some research on this thing, and I think this is what happened to me. EMTALA, E-M-T-A-L-A, the Emergency Medical Treatment and Labor Act, EMTALA, was part of the Consolidated Omnibus Budget Reconciliation Act of 1985, C-O-B-R-A, COBRA. President Reagan signed EMTALA into law on April 7, 1986. Since then, Congress has amended the statute multiple times. EMTALA was enacted to address the problem of patient dumping. Patient dumping refers to the act of hospitals denying individuals emergency medical screening and stabilization services or transferring them to other hospitals once a hospital discovers that the patients are uninsured or have no means to pay for treatment. Patient dumping also includes a hospital's denial of treatment for discriminatory reasons. Certain situations where hospitals fail to screen, treat, or appropriately transfer patients are violations of federal law, that's United States federal law, including civil rights laws. Before EMTALA, most hospitals in the United States could refuse to treat anyone. After EMTALA became law, Medicare participating hospitals must provide a medical screening exam to any individual who comes into the emergency department and requests examination or treatment for a medical condition. If a hospital determines that an individual has a medical emergency, it must then stabilize the condition or provide for an appropriate transfer. The hospital is obligated to provide these services regardless of the individual's ability to pay and without delay to inquire about the individual's method of payment or insurance status. However, there is no obligation upon the hospital to provide any treatment beyond what is necessary to stabilize the patient, nor any prohibition against discharging or transferring the patient elsewhere. Alright, so if you go back and look at my 6 hours plus video documentation on my injury, you'll see some things that I think may pertain to this EMTALA business. And when I went into St. Vincent's East Hospital, after you get it, you have a screening, like a pre-screening, and you go into the back into this room, and then somebody will show up in the room pretty shortly thereafter every time, and they will come and ask, how are you going to pay for this? Do you have insurance, etc.? And then based on what you say, and I have no money, insurance, or anything, but what happened in my case was the nature of my injury. It is very obvious in the photographs, the CT scans, the MRIs, and the X-rays. All right. What it looks like happened in my case is the radiologist in all of these images, they did not see my injury correctly. They did not diagnose my injury correctly. So it looks like this is another tactic that they are employed in these hospitals to get around this. They'll go in, they'll give you an X-ray or CT scan, MRI, but then in the interpretation, this appears to be like a choke point, and depending on if you have insurance or money or way to pay, they may or may not correctly diagnose these things. That's what it looks like to me. I got 5 scans, okay? I got an X-ray, I got 2 CT scans, no contrast. I got a CT scan with contrast. I have an MRI. St. Vincent's Hospital, Birmingham, Alabama, Ascension Health. All right? Now, in the majority of these images, a very clear injury shows up in the same area. And it's in the basilar region of my skull, occipital condyle, condylar canal, and foramen magnum. You can see broken bone, you can see infection, you can see swelling, you can see a possible CSF leak, and all my symptoms resonate with this. I may have had meningitis. I had 3-inch long parasite worms grow a nest in this wound because it was misdiagnosed for 2 years. So this is what happened to me. You know, I think I was patient dumped, among other things. Look at my videos, look at my documents, and I think that many laws were broken in the process of me trying to get this thing treated and diagnosed. This is unacceptable, unexcusable. So here we go. EMTALA. Research this thing. Look at my case. Hey, if it happened to me, it may happen to somebody else.